The Delta surge continues to drive very high COVID-19 cases, especially across northern Ohio, and very high rates of hospitalization. Yesterday, we reported 8,707 cases of COVID in just the previous 24 hours. Also, as of yesterday, there were 4,297 patients in the hospital with COVID-19, a high we last experienced in January of this year. And that was during last winter's surge. 1,100 of those patients were in the ICU, higher than we had during the height of our recent fall surge, and consistent with numbers we experienced 1 year ago, last December, just as COVID-19 cases were becoming available, vaccines were becoming available to the very first Ohioans. Now, the current surge in COVID-19 hospitalizations is simply putting a dangerous strain on the state's healthcare infrastructure. We are, yet again, in a serious situation, every bit as serious as last December and January. Hospitals are being severely strained, not only because of the high numbers of COVID-19 hospitalizations, but also as a result of staffing challenges, particularly among the dedicated healthcare workers who have been fighting this virus on the front lines for months and months on end. When our hospitals are stressed to this degree, it strains their resources to care for other patients needing regular or emergency care. So it's not just about our hospital's ability to care for a COVID patient. It's also about their ability to care for other important conditions like heart attacks or car accidents. As a result of the incredible volumes hitting our hospitals every day, our hospitals are having to make very difficult decisions and implement contingencies to cope with the volume and to deliver care to those most in need. Now, many have diverted to not only accepting the patients who may have previously been referred to them, but accepting, for example, only traumas that meet certain criteria or have had to reschedule many surgeries or other procedures. They've diverted patients to other hospitals far from where people live, and they've even had to limit patient visitation. Now, what's driving all of these Delta hospitalizations in Ohio? Well, when we look at the data, our COVID-19 hospitalizations continue to be driven largely by unvaccinated Ohioans. Severe illness with COVID-19 is, as we know, largely preventable thanks to our vaccines. The facts continue to provide us a clear reminder that when Ohioans choose to be vaccinated, they're better protecting themselves from severe illness, including hospitalization and death, and they help mitigate pressure on our hospitals so that timely care is available when any of us need it. When someone chooses to be vaccinated, they're helping to ensure all Ohioans get the medical care they need when they need it. The rate of hospitalization is very high in communities all across our state, reflecting our very high case rates. But the problem is especially acute in the north. An analysis of hospitalizations over the last 2 weeks shows that on average, about 62% of all newly reported hospitalizations occurred in the northern part of our state. Now, not surprisingly, recent data also shows that as a whole, hospitalization and death rates are higher in counties that fall below the state vaccination average. So it's clear that higher vaccination rates are associated with lower rates of hospitalization and death. And conversely, lower vaccination rates are associated with higher hospitalizations and deaths, because that's what vaccines were created to do, to keep people alive and out of the hospital. Now, we looked at this data specifically from April 1st through November 28th, after vaccines were available for everyone age 18 and older in Ohio. And our findings show that COVID-19 vaccines have consistently worked as designed, which is to protect us from severe illness, the kind that results in hospitalization or death. While you might, as a vaccinated person, still get a mild case, the COVID-19 vaccines do a very good job of protecting you from serious illness. Generally, we found that hospitalization rates are 35 to 40% higher in counties that fall below the statewide vaccination rate average, compared to counties that are above that statewide average. Furthermore, death rates are up to 94% higher in counties below the statewide vaccination average. In short, all the evidence reinforces that COVID-19 vaccines are our surest protection from severe COVID illness, including hospitalization and death.